Okay, so for those of you who are just joining, once again, my name is Andy Smith. I am the lead content writer here at Kontakt.io, and today is my privilege to welcome y'all to our webinar, Nursing Workforce Job Satisfaction, the Role of Staff Safety and Technology Integration. Hosting the webinar with us today is Crystal Galdamez. Thank you, Crystal. As a brief introduction, Crystal Galdamez is a passionate advocate for the profession of nursing and healthcare innovation. She has spent 20 years in the healthcare industry, with the last 10 of those years working for health tech organizations. In the first half of her career, Crystal's experience includes working the front lines in ICU nursing at level 1 trauma institution during what she calls some of the most rewarding and adrenaline-filled years as a night shift ICU nurse, as well as experience as a clinical consultant for a national health system in the Department of Healthcare Economics and Analytics. Today, she dedicates her passion for the profession of nursing and tech innovation to help health systems drive safety and satisfaction for staff and patients and leverage the cost reduction strategy that those elements can bring forward. Wonderful. Thank you, Crystal, for joining us today, and I will turn it over to you.
Awesome. Well, thank you, Andy, and greetings to the viewers, the listeners of this webinar. You know, as Andy mentioned, I have spent time on the front lines working night shift ICU, so this is a personal topic for me. I have personally experienced and witnessed one too many situations of threat or violence to where I have feared for my own safety or the safety of the staff around me. And that is why it is very important for me to speak on this topic today, and I'm grateful for the opportunity. So to guide our webinar discussion, I've organized the session around 3 key points. First, we will discuss the urgency of the problem. We'll explore the current reality of nurses quitting their jobs, examining how safety concerns and burnout are key drivers of this trend. We'll discuss the impact this has on healthcare systems, patient care, and overall well-being to staff and subsequent hospital margins. Secondly, we will cover the power of job satisfaction within our healthcare workforce. We'll shift gears to look at the research that demonstrates the correlation between high job satisfaction and positive outcomes. We'll see how improved employee satisfaction leads to lower turnover rates, better patient outcomes, and increased productivity. And finally, we will cover on technology as a solution. So we'll cover innovative ways technology can enhance safety, prevent burnout, and ultimately contribute to increased retention. So throughout the session, folks, I encourage you to consider these crucial topics, tap into your own experience on the clinical, operational, and financial stresses that are playing out today in your own organization. So let's kick off by unpacking nurse turnover, okay? Nurse turnover rates have fluctuated over the past 3 years between 20–30%. And while turnover rates in 2023 have decreased slightly from 2021, the labor gap remains alarmingly high overall, and hospital turnover continues to be elevated. So as of today, the latest data regarding annual nurse turnover comes from the NSI National Healthcare Retention and RN Staffing Report. And in January of last year, NSI invited over 3,000 hospitals from across the country to participate in the nation's most comprehensive survey on healthcare turnover. And their findings revealed that nationally, the hospital turnover rate stands at 22.7, and RN turnover is recorded at 22.5. Furthermore, a 2023 report by National Nurses United, NNU, had some key findings I want to share with you. 81.6% of nurses surveyed experienced at least one type of workplace violence within the past year. 81.6. And 60% of nurses have considered leaving their jobs or the profession entirely due to workplace violence. And of course, we have to look at what that means as far as cost implications. So according to the survey, the average cost of turnover for a bedside RN is $52,350, resulting in the average hospital losing between 6.6 and 10.5 million. So now looking forward, if we think about this, each percent change in RN turnover will cost or save, depending on which direction you go, the average hospital an additional $380,600 a year. So yes, addressing burnout and nurse turnover is extremely crucial. Now, let's look at what the research says on the correlation, right? So we have the problem of nurse turnover, but what's the research say on the correlation between staff safety, job satisfaction, and positive outcomes in healthcare? So there's a growing body of research exploring the interconnectedness of staff safety, job satisfaction, employee turnover, patient outcomes, and productivity in the healthcare industry. This research consistently highlights a strong positive correlation between these factors, suggesting that prioritizing staff well-being can lead to significant benefits for both patients and organizations. So first, let's look at staff safety and job satisfaction. Studies have shown that employees who feel safe at work, they're more likely to be satisfied with their jobs, right? This makes sense. This is attributed to factors like reduced stress, increased trust in the organization, a greater sense of control over their work environment. For example, a study published in the Journal of Nursing Management found that nurses who perceived a higher level of safety culture reported higher job satisfaction and lower burnout. When we look at job satisfaction and employee turnover, a study published in the International Journal of Nursing Studies found that nurses with higher job satisfaction were 2.3 times less likely to leave their jobs compared to those with lower satisfaction. And when we look at job satisfaction and productivity, a study published in the Journal of Business and Psychology found that employees with higher job satisfaction were 12% more productive than those with lower satisfaction. And importantly, let's look at staff safety and patient outcomes, right? So what does all this mean at the patient level? Well, studies suggest that a safe work environment for staff can lead to improved patient outcomes. And this is because, again, reduced stress, right? Feeling safe can decrease stress and anxiety among staff, leading to better decision-making and improved care quality. Also, it's increased focus for the staff. So a safe environment allows staff to focus on patient care without worrying about their own safety. And there's improved teamwork. So a culture of safety fosters collaboration and communication, leading to better coordination of care and reduced errors. Research published in BMJ Quality and Safety found that hospitals with a strong safety culture had lower rates of patient mortality and complications. That's a big deal. So yes, the healthcare industry faces a critical challenge: ensuring staff safety, reducing nurse burnout, and increasing retention. Smart hospital technology offers emerging opportunities to address these issues head-on. So what is smart hospital technology? Well, in the context of this webinar today, a smart hospital is one that uses advanced technology such as digital workflows, big data, plus artificial intelligence, IoT, right, which is the Internet of Things, and connected medical devices to improve the delivery of care and increase operational efficiency. Now, what is the goal of a smart hospital? Well, it's to provide high quality, patient-centered care that is more efficient, more cost-effective, and safer than traditional healthcare delivery. One of the key features of a smart hospital includes access to real-time location and status of key human and capital resources that keep the hospital functioning efficiently. Many of the most beneficial use cases in smart hospitals are based on this ability to monitor locations in real time. Why? Because it provides stakeholders insights into things like workflows, asset utilization, patient care, and overall operational efficiency. Smart hospitals can adapt clinical processes, patient care policies, and general facility management based on the data available from tracking the physical location of people and assets. And by the way, for a little more education on these technologies, so there are three primary technologies that can provide the basic network for smart hospitals. And while each of the three technologies has its pros and cons, on balance, Bluetooth Low Energy, or BLE, is the best choice for several reasons. Number one, it's open source, scalable into multiple use cases as most IoT sensors incorporate a BLE communication protocol. Number two, BLE is embedded in most infrastructure networking devices like Wi-Fi access points, cameras, tablet displays, and even lighting, which can participate in location detection as well as data backhaul. And number three, battery life in BLE devices is much longer, meaning less maintenance and lower cost of ownership. Kontakt.io solutions use BLE, Bluetooth Low Energy, for these primary reasons, with a vision and promise to customers that their IoT roadmap is secured for the next 5 to 10 years. So taking a deeper dive into how these technologies orchestrate staff safety, okay? So simply, it's by way of instantly identifying the exact location of the employee under duress. So we're talking real-time visibility into staff safety. Nurses can have wearable wireless devices such as a smart badge holder that can be activated in different ways in the event of a threatening situation. The technology can be used to activate customizable notifications, which are then pushed to a central command system or wireless mobile device, and the exact location of the duress is pinpointed with room-level accuracy. Hence, nurses feel empowered and safer because they are empowered and safer. An environment of care where nurses feel safe, valued, and empowered to provide exceptional care is necessary. And we must have a sense of urgency and proclivity for action to face this issue head on. In fact, in my home state of Texas, so listen up, my fellow Texans, Senate Bill SB 240 signed into law in May of last year, which aims to reduce workplace violence against healthcare workers, is more evidence this issue is warranting serious attention. Under this bill, key provisions that must be established by September 1st of this year include mandating written workplace violence prevention plans, establishing workplace violence prevention committees, and training requirements. At Kontakt.io, we are positioned to partner with hospitals in this vein and digitally transform care delivery and complement their prevention plans and training systems with our AI-powered technology. Technology is a beacon, pun intended, of hope. So for my techies, I hope you caught this. But lightheartedness aside, protecting our healthcare workers really is a top priority, and we must do better. As we close out, I'm proud to sit in this position with Kontakt.io. We build technology that allows end users and hospital administrators to understand how patients move through the care delivery process. In fact, how everything moves, really. We uncover waste, optimize workflows, and help staff and patients feel valued. In other words, digitally transforming care for the better and improving hospital margins. It's a win-win. Cloud and IoT sensors make it possible for us to collect big data across the care delivery operation in an affordable and scalable way. AI makes it possible to use this data to build responsive health systems that anticipate and adapt to constantly changing operational and human needs. And by leveraging technology thoughtfully, we can create a healthcare system that prioritizes both patient well-being and staff safety and satisfaction. So I want to thank everyone for listening, and I'd like to leave us on this reminder. Workplace violence is not part of our job. We cannot afford to remain status quo on this, and investing in our healthcare workforce, investing in our nurses, it's not an expense. It's an investment in the future of healthcare with a true ROI. So thank you again for joining this webinar, folks, and thank you for all you do every day to impact the future of our patients and staff.
Excellent. Thank you so much, Crystal. That was really, yeah, staff safety is a critical challenge for sure, and very sobering to look at the numbers behind that. We have a couple of questions. We have a little bit more time that we can get to. If anybody else has any other questions, please go ahead and drop them in the Q&A. Time permitting, we'll get around to all of them, but otherwise, you can reach out to me or to Crystal directly. Her email is on the screen at the moment. Let's start with this question. First question, can your staff safety system work with an existing RTLS vendor? For example, if the healthcare system already has an existing asset tracking RTLS system.
Mm-hmm. Yeah, that's a great question. And the answer is simply yes. So absolutely, we can work with third-party software. We can work interoperably with other RTLS vendors and can further enhance and provide asset management benefit, but also beyond that, we can exist within the existing RTLS system. It doesn't get in the way, and you can take other use cases with the Kontakt.io platform. So staff safety, as we've discussed today, hand hygiene, patient elopement, wayfinding, and more. So yes, they can coexist together.
And then I guess somewhat related, what is the integration methodology of Kontakt.io's safety solution?
So we have an open integration and decoupled architecture. So our philosophy is keep it simple and keep it open, meaning we can work and integrate, like I said, with third-party hardware and software like nurse calls, EMRs. We can leverage the networks that are already in place. So whatever Wi-Fi network you have in place, all of that is very easily integrated, and it's very simple. It's easy, it's scalable with web streams, webhooks, RESTful API, so it's not complicated or cumbersome, and customers love that. So we really pride ourselves on that piece.
Excellent. Couple more questions coming in. Let's see. What does implementation time look like for Kontakt.io's staff safety solution?
I love that question. Yes, a lot of people are super surprised when they realize that maybe their experiences from the past are not going to repeat themselves. One of the things that we really pride ourselves on, as well as being easy to work with, integration friendly, is our speed to value. So this is an area where we oftentimes find customers think this is going to be a 6-month or longer project just for their one facility. But just to kind of give people a sense, we could go live within 4 weeks for an average 200-bed hospital. So we're not pulling wires, we're not opening walls, we're not patching and painting. It's not anything like that. Room downtime is not even a factor, so patient care is not interrupted. So very much so, I guess, for a lack of a better term, a plug and play experience.
That's great. Excellent. Okay, looks like one last question here from Paul Zell. I think this is an interesting question, Crystal, and you may want to answer this from your own personal thoughts or experiences, but the question is, are staff concerned about privacy while linked to these safety devices?
I think so I've been doing this for a little over 10 years. I would say that 10 years ago, when this type of technology became relevant in the sense of staff wearing badges and location approximation, I think at first staff questioned, right, their privacy and the term, I don't hear it so much, but yes, they used to say the whole big brother thing. And that really doesn't come up very often today. I think people are used to wearing tech. I mean, my watch is tracking me all the time. My phone's tracking me all the time. I think when they realize there's no tracking of the employee. What it is it's making sure that if they ever are in a situation of duress, that their exact location can be pinpointed in the most expeditious time frame, and help can be in their, in with them in the most expeditious time. So yeah, it's a good question, Paul, but really once we start training the staff and they realize what they're getting, it's really not a big deal. And then once you tell them, hey, your watch and your phone are tracking you anyway, they're like, yeah, that's true. So
Yeah, I think you make a good point that maybe a few years ago or 5, 10 years ago, it might feel more foreign or invasive, but I think today people appreciate the real value of it, and in this instance, like knowing precisely where the incident is occurring, precisely where that nurse or staff member is, as opposed to red phones or panic buttons under desks. You're in a situation, you press the panic button under a desk, but then you leave the room,
right.
and security shows up to this empty room now. But the technology that we have now is so precise and so accurate that I really think it makes a huge difference to have the wearables when it comes to staff safety, for sure.
Yeah.
Okay. That is our time. Crystal, once again, thank you so much for this presentation. For our folks attending, as you'll see, Crystal's email is on the screen now. If you have any other questions, any follow-up questions, please don't hesitate to reach out. We're also eager to hear feedback. If there's a topic that you'd like us to explore further, if there's something that's more top of mind for you today, please let us know. As we continue to program our upcoming webinars, we'd love to hear from our attendees. So again, thank you for joining us today for this webinar. My name is Andy Smith. My email is a.smith@Kontakt.io, just like Crystal's format. Thanks for joining us. And once again, thank you so much, Crystal.
All right. Thank you, Andy. And thank you to everyone out there. Have a good one.
Bye.